we're going to ask Rhodey some frequently asked questions for hair loss and treatments today. Don't forget, revivemyhair.com.au. Okay, Rhodey? First question. Is hair implants a permanent hair loss solution?
So the question is a little bit tough because, first of all, it's not a solution at all because it does not treat the cause of hair loss or any further hair loss. So in regards to being asked a question like that, which most people ask, it'd be funny to ask that because it does not treat anything. But what it does do is this: if a person's hair has thinned out and then eventually fallen out, the skin seals up and then they've got what we call patches or a bald spot. That area will require implants because no amount of treatments or anything on the market or anything in regards to even PRP will grow a new hair follicle. Once the hair follicle falls out, it's gone. So in regards to implants, that is to fill that area up. Now, ironically, after the implants are conducted by the surgeon, at the end of the session, there's a PRP, a treatment that they do, and then they will tell the patient, make sure that you do PRP 3 months from now. Now, this is not for the implanted hair. This is more for the hair that's there already. So the top of the hair of the scalp, that hair is not immune to DHT. Only the sides and the back, which is the donor area. Now, that means the rest of the hair that's on the top, you could have thousands of it. This particular hair will continue to thin out and eventually fall out. So if that person done an implant, the implants will remain after 2 years, and then the other hair would be thinner and eventually fall out. So the treatment is for the existing hair. So you want to maintain your existing hair. Anna's going to do a few injections on my face, so it'll be harder for me to talk. But when she's doing my hair, I'll continue to answer the rest of the questions.
I'm just pausing this one. How do I rethink it? Do I just press back?
So no, so let me show you.
So confused.
So what did you pause here? Is it here?
Yeah.
And you just go back here. You don't have to, you just pause it and you just leave it. You don't touch it on that one. And then Facebook Live, just keep running.
It's going. Okay, I'm going to start recording again. So these are the facial injections. They don't hurt.
How many injections will you get out of that syringe, Anna?
Up to 15.
Okay.
It's one more syringe.
Mm-hmm.
Just come towards me. Do you feel that one?
Yeah. There's Rosa. You're hiding, Rosa.
No, I'm getting better vision. I'm the professional here.
Is there enough lighting for you?
Mm-hmm.
Next week we'll do yours, okay?
We'll see how Rosa feels about coming to work with no makeup. See if I feel revived.
No, we'll do it at the end of the shift. We'll do it at the end of the shift. We'll take off your makeup and then no one will see you.
It's okay, I'm beautiful without
Except
it anyways.
on Facebook.
It's okay.
A little bit. I'll answer some questions afterwards, just I can't move.
Just, getting in his personal space as you do.
Wait, and now I'm going to laugh because she's making me laugh.
I'm getting in your bubble. This is live.
Sorry.
We're all full of fun here. I revive my hair. I am the better looking one. I should have been getting recorded. So I'm sorry. Okay.
I didn't do any numbing cream then here, by the way.
Soldier on. I didn't do it with numbing cream. Going to start the hair soon, so stay with us. Okay, can I start?
Yeah,
my
sure.
next question. Okay, how long does PRP take to work? Very frequently asked question.
Okay, so to explain what PRP is doing from the very start, so I can actually answer that question. For hair loss, let's go for hair loss and then we'll come back to face.
Yep.
For hair loss, for that question, it would mean there'd be two different types of hair loss situation. The person is shedding rapidly, and what we need to try to do with PRP is to control the hair loss so that it's not shedding as frequently until it actually stops. So for that person to see pretty much results, they will see it within the first 4 treatments. For a person that their hair is just thinning and it hasn't begun to really fall out rapidly and so on, that person isn't going to see the thickness of the hair until really 6 months. Why? Because it's called the hair loss cycle. So, and hair growth cycle, sorry. So hair growth takes 6 to 8 months. So it means the hair follicle that is receiving the nutrients will start producing thicker hair, which was originally how it was before, because it's receiving nutrients now. It starts to pretty much produce thicker hair. So that cycle takes roughly about 6 months. So if I'm answering that correctly, the initial things that you will see is that the hair loss or shedding will dramatically slow down. For a person that's just coming for that hair's thinning, it's not really shedding rapidly. That person will not see the results thereafter because they're thinking, well, you know, I want it to be thicker straight away. It's not possible. The hair growth cycle takes 6 months. So in 6 months, that person will see thicker, stronger hair. But the person that's shedding, which is most probably 90% of the people that will come for the treatment initially, they'll come because their hair's shedding and they're freaking out. And within 1 to 4 PRP treatments, they're pretty much their shedding will slow down to 0. Now, obviously, everyone sheds normal hair, but rapid hair loss means there's no nutrients there. So the next part of the question, because it wasn't made for hair or skin, would be for skin. And most probably it's going to be for face or hands or wherever it is that they're treating. What PRP does is activate the collagen within the skin. So it's almost like activating. We don't produce, so we're not putting in collagen, so we're reactivating by making micro wounds in that area and then re-injecting the PRP. You're basically boosting that whole area up. So you're going to get tighter, thicker skin that's more healthy. Picture it like a ground that does have no nutrients. You will need to have nutrients in that ground and then water it so that everything around it will grow stronger. So same thing, dry skin, you need to basically get to the source by injecting. You're actually activating that area. And same thing for the hair. So for the top area for the hair, your scalp's actually, the skin is actually getting better. Just like on the face. So if you had dandruff, it meant before you had dry skin, all you're probably doing is washing your hair with Head and Shoulders, thinking, oh, I'm fixing it. You're not fixing anything. You're just washing the top area. By having PRP treatments, you're actually fixing the source. And the source means the skin is getting fixed and the hair follicle. So there's a whole heap of things that are working on different levels there. And that's a quick summary. Any other question?
Okay. My next question is, can anyone do PRP?
So again, because of the general questions, the person generally asking these questions don't know much about PRP. And that's okay, stay out. We'll talk from there. So, can anyone do it? Look, generally you want to do it your of age. Now, PRP I'm assuming for the hair and for skin. So I'm just jumping on both there. So let's answer for the hair. For the hair, obviously your hair would be shedding or would be thinning for you to want to do PRP. So yes, anyone can do it, male or female, and it will have results that will vary according to your nutrition. Now, obviously, if you're eating well, your diet's well, then your PRP, which is an extraction from your blood, will be more, if I can say, will work better. It's stronger, it's potent, it's more stronger. And you will know because your diet will really determine the quality of the PRP. Now, if you're on medication like blood thinners, aspirin, that will affect the PRP, and you will not get 100% from what you want from the treatment. So these are the questions that we ask. Do you have cancer? Do you have any diseases? Certain skin cancers. Because PRP is so good that if you did have skin cancer, it would actually boost the cancer in that area. So obviously what you're doing is you're boosting that area to work. So in that respect, no, if you had cancer, you wouldn't do it. You can go ahead, doesn't matter. Yeah. So what we're doing now is, this is the mesotherapy gun. We're injecting the actual PRP, and you can see the color of my PRP. which is quite a good colour. That means I've been eating well. So what we did, Anna, which is a registered nurse, had extracted a sample of my blood and basically has placed it in the centrifuge machine and separated the PRP. PRP goes to the top, the red and white blood cells drop to the bottom. So this is what is getting re-injected back into the scalp, and as you saw before, into my face, which is the skin, for collagen reproduction, and for the scalp, really for also collagen reproduction and for hair follicle rejuvenation. So it's sort of working on both ends here. So again, same thing, question was asked, is PRP for anyone, or can anyone do it? Most people can, yes, there's no reason why you couldn't. You can do it for face or for hair. It will work really with anyone. I think you're going to ask me another question later on. Could you be allergic to it? But I'll answer it in the next question.
Okay, I'm just pausing for a minute. Are you okay to keep going? Ready?
Yeah, that's fine.
Okay. Thought I lost him there. Is there any side effects with PRP?
Not at all. PRP is really you, so you can't be allergic to yourself. It's not mixed with anything. Some places in America do mix it with different additives, different things, different activators. We don't. It's pure PRP. So all we're doing is re-injecting it really back into you of what we extracted. We're not mixing it with anything, so you can't be allergic to it at all.
Okay. So we're moving on to our final question for all our live Facebookers. How does hair and facial PRP treatments work?
So let's go to the core of that question. PRP is platelet rich plasma. So like I said before in the previous questions, it is an extraction from the blood, and basically PRP, the abbreviation, is the nutrients, and these are the magic healing nutrients of our body. So they normally rush within the blood, they rush to wounds, to areas to fix throughout the body. That's what it normally does. Now some people might say, well, why isn't it fixing my hair loss? It's not fixing your hair loss because it doesn't pick up hair to be a problem. It doesn't think hair is in trauma. It does not think that it's a wound, so it doesn't fix it because it's a real slow, progressive, if I can say, deterioration. And what happens as you get older, your body's going to go send the nutrients to the areas that need it most. It does not think your hair needs it the most. So what we are trying to do, like we are here, is manually re-injecting the nutrients into the area that needs it manually, because this area now, as Anna's injecting, is obviously getting the nutrients now manually because it was lacking it before. I did lose my hair. I was thinning, so this is controlling the area to receive the nutrients directly where I need it most. If I leave it unattended, then yes, eventually the DHT levels, which is another real question, is the chemicals that are going to attack the hair up the top. It will eventually thin out my hair to the point where the hair follicle no longer produces thick, strong hair because it's not receiving nutrients, and it will eventually fall out. When it falls out, nothing can bring it back. And that goes to the first question, implants. That will be your only way that you could fix the gaps. Now that doesn't fix your hair loss. What it does is fix the gaps between the areas that have been that have fallen out. So you want to maintain as much hair as possible up the top. If you lose all of it, you will not have enough hair on the sides and the back of your head to actually relocate up the top. So roughly you've got about 70 to 80,000 hairs on the top of your head, roughly at about age, say 14 to 17, and around 30,000 on the sides and back. So it's not possible that you can relocate all the ones on the side and place them up the top. Firstly, you would look bald on the side, and secondly, you will not have enough hair to cover the top. So essentially, you want to maintain the hair that you've got on the top. If you're starting to notice thinning and it's starting to fall out, you need to quickly seek treatment. And obviously PRP is the main treatment for you. So you maintain what you've got. If you've got gaps in between where you just can't treat because hair's gone, then that's where you might consider doing implants, which is really hair relocation from the donor areas on the side and the back to the areas that need it the most, where it just doesn't have any hair there. So you fill it up and then you maintain your hair pretty much for a lifetime. You don't have to lose your hair because your dad or your grandpa did. Yes, it is hereditary and you are affected. 80% of men are affected, or around 20-30% of women are, but you don't have to accept it and say, well, that's how it is, it's in my family. You can stop it because you're basically manually placing the nutrients there, and it's going to obviously reactivate that whole area. Any other question?
Nope. That sums up our questions for the PRP treatment. Thank you for joining us on Facebook Live. Please.
Sorry, Rose, I'm going to just look because we jump straight to it. Initially, what we do is we put numbing cream on. So the numbing cream numbs the skin on the face and the hair. So really, it's slight discomfort. It's nothing. I mean, you notice I was just talking all the way through it without any issue. So it's here. I'm not feeling anything. I'm not. Is she doing it? I can just hear the noise. So some areas you don't feel anything, 0, up to about 4 out of 10, being 10 the worst. Some people come in and they don't even use any numbing cream whatsoever. So you might feel a little bit of discomfort in certain areas, but throughout it's quite an easy task. It's not massive complications. There's nothing that could happen. As soon as we finish, Anna will clean up that area. She'll put aloe vera ointment on top. That'll lock in the PRP because your pores will close up, and then you can go out, do your own business, do whatever you want to do. It's not going to scar, it's not going to have any negative effects. So in terms of scarring or anything, nothing. In terms of does it stay irritated, within 2-3 hours it's gone. What we do say is the time that you do it until the time you shower or you wash your face, let it be 6 to 8 hours. 8 hours better. So if I'd done it now, this is night time now, I would basically just wash my body tonight. I would leave my face and my hair till tomorrow to wash it. Just because I will have PRP on it and I want to get the maximum I can out of it. I know that the questions there, but I have been asked many questions where, how do I know how many treatments I need? Let's concentrate more for the hair, because for the face, really, it's as you want. How vibrant do you want your skin to be? But for the hair, initially you want to maintain and reduce the hair loss. So you want to do it closer together. So what we've got to do is a program where we do 2 in a month, then we do 2 in every month after that, and then we do 6 weeks 4 times, then we do 2 months twice. Then after that, really, it's maintenance mode. So initially it's a booster, then after that it's maintenance. So what you're trying to do is basically get to a point where you're maintaining your hair, just nutrients in that area, 3 to 4 times a year. And then that will be sufficient. No ointments, no pills, nothing. I know there's minoxidil, I know there's Proscar, there's many things that you can take. Proscar, you need to take it every day. Minoxidil, you have to take it every day, twice a day. So really, it's not a solution that works well with your life. PRP is, you'll do it literally 3-4 times a year after that, and it'll be more than enough. So you come in for an hour, get it done, and it's done, it's finished. So literally as if you're watering the plant. That's all you're trying to do. So in terms of freedom, it is the freedom. I'll leave Rosa to actually speak about the packages because it's out there, so she can work out the packages and give pricing. Thanks, guys.
Now, who's your favourite receptionist?
Rosa, number 1. And my favourite nurse is Anna. And I've got Yoshi too. Yoshika.
Peace out, guys. This is our clinic. These are our prices. So, you buy one treatment, $385 per treatment. With an additional vial, it's $70 for the same area. However, if you buy a 4 package, $1,140, so it totals to $285 per treatment. Again, if you want an extra vial for the same area, it is $70 extra. 6 package goes for $1,590. Per treatment's $265, additional vial again $70, same area. Buy 8 packages, $1,796, ends up being $224.50 per treatment. Again, additional vial $70 for same area. Now, this one is for new clients only. It is recommended because you are starting from scratch. So it's over 12 months PRP treatment package. It costs $1,960. Your first 2 treatments every fortnight, 3rd and 4th treatments every month, 5th, 6th, 7th and 8th treatments every 6 weeks or 8 weeks. 9th and 10th treatment every 2 months to 3 months. It's pretty much how we work it. It includes 10 treatments. It's obviously designed for new clients because that's what we get out of it. Now, that is the hair one. We will then move forward and do the face and skin one. These are the packages for face and skin. Buy one treatment for $349, another one $349, and the one that's got the dermapen and the injections are $385. However, if you decide to buy 4 treatments, that is only with dermapen for micro wounds, no injections, it is $1,180 for the package. You can buy 4 for $1,180. This is for people, this is not a PRP, this is a mixer of vitamin C serum and hyaluronic acid mixer, dermapen, and up to 10 injections if required, but it is not your PRP. Then you've got the buy 4. This one costs $1,360. PRP with dermapen, up to 10 injections for deep lines, additional vial at $70 for the same areas. Contact us at Revive My Hair PRP on 0297482770. Please email us at info@revivemyhair.com.au or visit our website, which is www.revivemyhair.com.au. We are located in Silverwater and have parking. Thank you. Have a lovely evening, everyone.